progress. Thank you so much for joining us. This year, the health team is focused on exploring and advancing policy that makes healthcare more affordable in ways that people can meaningfully feel. And so with that in mind, we're hosting a 4-part virtual speaker series highlighting the diverse reforms that states are pursuing and adopting to lower healthcare costs and also improve out-of-pocket affordability. And so I'd like to thank you all for joining us today for the first session in that series, Affordability Beyond Premiums, State Policy Efforts to Lower Marketplace Out-of-Pocket Costs. And so, as you all likely know, this year has been a very strong one for the marketplaces. There has been unprecedented enrollment on the ACA exchanges, with more than 20.5 million Americans enrolling in ACA coverage. And thanks to the American Rescue Plan Act, as well as the Inflation Reduction Act, these enrollees have secured historically low premiums. However, many are experiencing an additional affordability barrier beyond their premiums. So many are struggling to afford their out-of-pocket expenses. So whether that be copays or deductibles or coinsurance, we have millions of Americans who are struggling to access care because they can't afford those out-of-pocket costs. But over the next hour, we are going to be learning more about initiatives in 3 states, New Mexico, California, and New Jersey, to improve affordability and lower marketplace cost sharing for those ACA enrollees. And so it is my pleasure today to introduce 3 experts: Colin Bayo with the New Mexico Deputy Superintendent of Insurance, Miranda Dietz, Policy Research Specialist and Project Director of the California Simulation of Insurance Markets Microsimulation Model at the UC Berkeley Center for Labor Research and Education, as well as Laura Waddell, who is the Healthcare Program Director for New Jersey Citizen Action. Again, thank you so much for joining us today, and I am happy to pass the virtual mic over to Colin. But before I do that, I actually want to share a few housekeeping items. So first up, today's session is being recorded. The recording, as well as an event recap, will be available on the CAP Health website next week. To ensure that today's event is accessible to all of our attendees, closed captioning is available, and you can activate that feature by clicking the closed caption button at the bottom of your Zoom screen. In addition, please use the Q&A function on today's Zoom to submit your questions. We're going to try and get to as many of them as we can. Finally, recognizing that we only were able to highlight 3 states during this hour-long session, and I know that so many of today's attendees, we have representatives from, almost all of the other 47 states. And so we would love to learn more about opportunities and initiatives that might be pursued in your state or jurisdiction. So please don't hesitate to drop information into the chat to inform and enrich today's discussion. So thanks again for attending, and Colin, I'll go ahead and turn it over to you.
Great. Well, thank you so much for the opportunity to speak to you all today about the efforts in New Mexico to reduce out-of-pocket costs. My name is Colin Bayo, and I'm the Deputy Superintendent of Insurance in the state of New Mexico. And I do want to open up today by acknowledging that everything that I'm going to discuss really is built upon the foundational framework of the Affordable Care Act and the enhancements that were made under the Inflation Reduction Act. And really none of this work that we've done on this issue would have been possible without that foundational framework of the ACA. So I'll move to the next slide. So our efforts to tackle the problem of high out-of-pocket costs on the health insurance marketplace started in 2021 when Governor Michelle Lujan Grisham worked with the state legislature to pass a law creating the Healthcare Affordability Fund. And in the previous year, Congress had phased out the health insurance provider fee, which was part of the ACA's original revenue package. Our state stepped in to collect that revenue at the state level and then invest it in lowering costs on our marketplace, which reduced premiums for small businesses and expanded coverage to the uninsured as well. While developing these programs, OSI adopted premium alignment policies, which I know Laura is going to be touching on in more detail in her presentation. And I only bring that up to note that this decision did improve the premium affordability of gold plans on our marketplace, which reduce the barriers to plans with lower deductibles, and really set the stage for how we set up our out-of-pocket assistance programs. So the affordability programs supported by the Healthcare Affordability Fund launched in 2023, and we did create three premium assistance programs. One of those was a general program, lowering those premiums up to 400% of the federal poverty level. We also created a Native American specific premium assistance program to provide $0 options to members of federally recognized tribes up to 300% FPL. And then we also created a Medicaid transition premium relief program that buys down the first month's coverage for individuals who are transitioning from Medicaid into marketplace coverage. And that's been especially helpful during the unwinding period. But what I'll focus on today is our out-of-pocket assistance program. And before jumping to the next slide, I'll just note that this year, we have made some program enhancements and rolled out our clear cost standardized health plans, which when combined with that out-of-pocket assistance program really makes our plans more predictable and affordable for consumers. So using resources from the Healthcare Affordability Fund, we created our state out-of-pocket assistance, which we also call SOPA. And SOPA is currently available to those up to 300% of the poverty level, and it's going to be expanded to 400% in 2025. SOPA actually directly lowers deductibles, maximum out-of-pocket limits, co-pays, and co-insurance for certain plans on the marketplace. And to administer this program, we really built off of the federal model of cost-sharing reductions by requiring our carriers to submit enhanced versions of their plan offerings that have reduced out-of-pocket costs. And then we also completely rebranded how we talk about plans that qualify for our out-of-pocket assistance. And we actually call these turquoise plans. So we did a little bit of kind of local branding on how we talk about these as well. So turquoise plans are, for all intents and purposes, really a marker for how consumers know that they qualify for extra out-of-pocket assistance. So when a consumer visits our marketplace, the platform determines their eligibility for SOPA and then automatically marks those plans as turquoise that qualify. We've also updated our plan sorting methodology so that those turquoise plans are displayed at the top of the list for eligible shoppers. And this also helps take the confusion out of having to determine the correct metal tier to get that extra assistance. We have three different types of turquoise plans. Turquoise 1 is available to those under 150% FPL, and it covers 99% of the medical and pharmacy costs for an average consumer. Turquoise 2 is available to those between 150 and 200% FPL. That covers about 95% of those costs. And then turquoise 3 is available to between 200 and 400% and covers 90% of the costs. And these percentages that I'm listing here are called the actuarial value. They're used in the ACA to communicate the portion generally of the aggregate costs that carriers will cover and that the consumer does not have to pay. I also want to point out that there's one unique feature of our program design here, and it really has to do with our underlying market dynamics. To qualify for federal cost sharing reductions, consumers have to select a silver plan. And as you can see, we adopted this approach for those under 200% FPL who really qualify for those generous cost sharing reductions. But for those over 200% FPL, we built our assistance on top of gold plans. As I mentioned earlier, our premium alignment policies significantly reduced the net premiums for gold plans. And to maintain that benefit, we built our subsidy on gold for the population over 200% FPL. And this actually also helped us stretch our resources further because we started from higher AV gold plan instead of a lower AV silver plan. And then we were able to use the savings we generated by doing that to actually extend the assistance further up the income scale. So that was a pretty unique design feature that's kind of at the core of how we've overall designed these programs. So as you can see here, unsubsidized plans tend to have significant deductibles. So taking the example of a silver plan, here, a $4,800 deductible would be very cost prohibitive for most enrollees. The federal cost sharing reduction would drop that down to $100, which is definitely a great improvement. But for a lower income household, even a relatively small deductible and maximum out of pocket of $1,100 a year could still pose a pretty serious affordability challenge and serve as a barrier to care. So in this example, the turquoise plan caps the maximum amount that an enrollee would pay for medical services under this plan at $200. And we even have some plans that have lower out-of-pocket maximums than that. This is definitely a huge relief for individuals transitioning from Medicaid into the marketplace. And we hope that it made that transition easier for folks to absorb as they were transitioning in the middle of a plan year. I've also provided some other examples here showing how our out-of-pocket assistance program directly reduces those costs for consumers, but I'll move on to tell you a little bit about our standardized health plans, which these examples are based on. So in New Mexico, we call our standardized health plans clear cost plans, and these are the plans that all of our carriers are required to offer, and they're designed to make it easier not only to do those apples to apples comparisons between carriers, but they also have some specific features that make it easier for consumers to predict their costs when they use care. So carriers are permitted to offer up to 2 non-standardized options in the gold and silver categories, in addition to these clear cost plans. And one of the ways that we improve predictability is that we only use copays, not coinsurance for these plans. During our consumer focus groups, we heard loud and clear that coinsurance, which charges patients a percentage of the amount of the service that's provided, can be really frustrating and causes significant challenges for folks. And that's why we opted for more transparent copays in this model. We also minimize the number of services that are subject to a deductible and only place that deductible on 3 higher cost service categories. And then we organize the copay amounts in easy to understand categories, with services like primary care having the lowest copays, while ER visits had the highest copays. So I have provided some basic information here on the designs of our clear cost turquoise plans, and I won't go through this in detail, but we'll just point out some of the design features here. We kept the deductibles pretty low. Consumers are never charged for any mental health costs. And then the primary care and specialist visits are reasonable and use those copays instead of coinsurance. So in terms of the impact of these policies, one major thing is that our enrollment is up pretty significantly. We saw a 40% year-over-year increase, and New Mexico saw the biggest percentage increase during the open enrollment period among all of the state-based marketplaces. And part of this trend is due to the Medicaid unwinding and folks moving over to the marketplace, but it also has to do with improvements on our marketplace, the overall experience for consumers, the outreach efforts, and marketing, but also, of course, the affordability programs that make that coverage more affordable than it ever has been. We've also seen a big shift in the types of plans that people are enrolling in. So as most folks will know, bronze plans tend to have really high deductibles, silver plans without those cost sharing reductions do too. And nationally, the average deductible for a bronze plan was over $7,000, and for a silver plan was $5,000 for an individual. In 2021, we had almost 40% of our population on the marketplace enrolled in a bronze plan. After we adopted our premium alignment policies, that dropped to just 15%, and now it's less than 5%. And then at the same time, more than 70% of enrollees have signed up for gold plans. So that alone really marks a huge improvement in the economic protection being provided by health coverage on our marketplace. And then on the next slide, when we factor in the turquoise plans, the impacts are even greater. So more than half of our enrollees are signed up for a turquoise plan this year. 95% of our marketplace enrollees are in a gold plan or better, which is the highest percentage in the nation. And then as you can see, only a small portion of enrollees are signed up for a silver plan that doesn't have that out-of-pocket assistance applied. So we see this as a very positive sign that our incentives are having the right effect and people are enrolling in that higher value coverage. On our next slide, just one thing to point out, 97% of those individuals who have enrolled in a silver plan are enrolled in a turquoise version of that plan. Again, a really good signal for us that our incentives are aligned the right way. And on the next slide, you can see that nearly 4 in 10 people who picked a gold plan qualified for a turquoise version of that plan. And this number is expected to go up pretty significantly in 2025 when this assistance is expanded to 400% FPL. On the next slide, you can see we also saw a big jump in our turquoise plan enrollment between 2023 and 2024. It doubled among the lowest income eligibility category. It also increased 70% in that middle tier, and then 58% in the 200 to 300 FPL range. And then finally, just in summary, I'll leave you with the following takeaways. One, the policies that described today have improved the affordability of coverage and the financial protection that's offered by marketplace coverage significantly here in New Mexico. Second, there's definitely an interest that we're seeing from consumers in coverage that offers low out-of-pocket costs. And then finally, there's still more work to do to improve out-of-pocket affordability in the marketplaces, and we're constantly evolving our strategies to meet those consumer needs. As I noted at the top, the Affordable Care Act really built the foundation for the coverage affordability initiatives that we've done here in New Mexico. And I am really glad to see that there is so much interest in the next step of health reform, really leaning into these out-of-pocket cost issues and making it easier for people to afford to stay covered and see their doctor. So thank you so much for the opportunity to speak today, and I'm really looking forward to learning from the other brilliant presenters today. Thank you.
Excellent. Thank you so much, Colin. I appreciate you sharing the latest and greatest on the work that New Mexico is doing, and also appreciate you grounding us in the importance of building upon the ACA's successes. Next, we will be hearing from Miranda Dietz from UC Berkeley's Labor Center. Miranda?
Thanks so much. Really excited to be here. I'm Miranda Dietz. I'm a specialist at the Labor Center. We work on the most pressing economic issues facing working people in California, including health insurance coverage and affordability. And as part of that work, I've been really lucky to work with both advocates and the staff of Covered California in implementing the ACA in our state. What I want to talk about today is the work that California has done both from the beginning of the ACA and more recently to improve access to care by reducing cost sharing. So I'm going to start from the assumption that high cost sharing is problematic. We know from survey data, I'm going to stay on that first slide for just a minute here. So we know from survey data, right, that already half of Californians are forgoing or delaying care due to cost, and more than a third of Californians have some type of medical debt. So there's this affordability crisis in our state. And I want to talk about 3 important things that California has done to improve cost sharing and access to care in the individual market in Covered California, our state marketplace. The first is only offering standardized benefit design plans, designs that emphasize first dollar coverage. The second is talking about reducing plan choice errors, so getting people in cheaper plans with better coverage if they qualify. And then the third is the newest, which is the state's enhanced cost sharing reductions, which have eliminated deductibles for folks below 250% FPL. Okay, so now we'll jump to the next slide and talk about standardized benefit designs. So California has been doing this from the beginning. All of the plans within a metal tier on Covered California have the same benefit design. If you're in a silver plan in 2024, urgent care is going to cost you $50. A trip to the ER will have a $450 copay, whether you're in Kaiser or Blue Shield or LA Care or whatever it is, right? So this allows for that apples to apples comparison so that you're shopping based on price, network, and quality, not on plan design. These standardized benefit designs help with cost sharing, right? Because it's done with a lot of care and thought into how to incentivize primary and preventive care. So there's first dollar coverage for most outpatient services, even for bronze plans, right? Bronze plans are not great in terms of cost sharing, but we know that people are going to be going into them. So how can we make them as good as possible? In bronze plans, the first 3 visits for primary care, urgent care, and specialist visits. This is on the right. There's like those little white triangles. Those are those three types of visits. Those ones, the first 3 visits have a copay and are not subject to the deductible. And all that blue stuff in the chart that's maybe too small for you to read, the deductible doesn't apply to most outpatient services, right? Pretty much the deductible is for if you wind up in the hospital. And that's like, 2 to 3% of covered California enrollees in any given year. So that's, a lot of thought went into designing these plans and trying to make it simpler for consumers. But a lot of people don't know or don't understand how that deductible works. This chart is so much simpler than comparing dozens of different plan designs, but it's still complicated, right? And so people might just know, I have a high deductible, I'm not going to the doctor. So we can move to the next slide. Because people don't always know what their deductible applies to, just the presence of a large deductible can be problematic. In 2021, which is where the data on this slide is from, deductibles were $4,000 for a single person in silver coverage and $6,300 for those with bronze coverage. We like to think about the Commonwealth's definition of underinsurance. And one of the markers of that is if people have a deductible that's more than 5% of their income. And when we use that definition and look at 2021, about half of covered California's enrollees were underinsured. So, of course, this definition doesn't take into account a lot of the trade-offs in plan design that were made and the fact that the deductible doesn't apply to everything, et cetera. But we still might think it's a problem that so many people have deductibles or had deductibles that were so high relative to their income. This graph, I'll say, it's showing covered California enrollment in 2021 when they were doing a lot of work to sort of explore the affordability challenges. It's by metal tier, right? Bronze at the bottom, gold and platinum at the top, and the different FPL groups for each bar. So almost everyone in bronze is underinsured. But even for folks 200 to 400% FPL, that silver level deductible was more than 5% of their income, right? So large deductibles is one problem. We can also use this slide to get a peek at another problem, which is plan choice errors. So the lowest income enrollees are eligible for cost sharing reduction plans that lower the out-of-pocket costs. But to get these benefits, right, people have to enroll in the correct plan. So even if someone is eligible for a Silver 94 plan, if they enroll in a gold plan, they'll be paying more and getting less. And you can see in these lower income groups that people aren't always choosing the silver plan with cost sharing reductions. So there can be some cases where that's intentional or does make sense, but using the data that Covered California has, they were able to identify people who had made a choice error and then either automatically enroll them during re-enrollment in a better plan through the same insurer for a lower cost, or to send them additional emails and letters to try to get them to switch. So on the next slide, you can see just a snapshot of some of the great work that Covered California did in testing these interventions to reduce plan choice errors. Unsurprisingly, switching people automatically, if you can, works best. Nudges like emails and letters do work, but inertia is strong and getting people to switch is really tricky. I recommend these health affairs articles for more details on the interventions that Covered California did and what their effects were. So this is sort of program 2 for improving cost sharing, right? Get people out of the plans with much higher out-of-pocket costs than they could have if they signed up for CSR plans. Now let's turn to their most recent efforts to eliminate deductibles. Perfect. So Covered California's new plan is California Enhanced Cost Sharing Reductions. These plans rolled out in 2024, and they help folks with income up to 250% FPL. So the folks who were previously eligible for federal cost sharing reductions. First thing it did was eliminate deductibles for everyone in those groups who enrolled in those enhanced cost sharing plans. The second is that for folks earning 200 to 250% FPL, they had been eligible for these Silver 73 cost sharing reduction plans, which is pretty minimal cost sharing help. The California program increases the actuarial value. Colin talked about that, right? That's the measure of the generosity of a plan, how much on average is paid for by insurance, from 73% to 80%. So basically a gold level plan for these folks. You can see in the blue boxes here what it would mean for someone earning 250% FPL, or just over $36,000 per year for a single person. So their copay for a doctor's visit goes from $50 to $35, generic drug copays from $19 to $15, and the deductible went from over $5,000 to $0. The budget for this program, I will mention, was $82.5 million. I know California is a big state, so for context, Covered California had 880,000 subsidized enrollees at or below 250% FPL in 2023. And California brought in more than $300 million in revenue from the individual mandate penalty in 2022. So California has this new program. Is it helping? Preliminary evidence is yes. So Covered California has looked at new signups, and enrollees are making fewer choice errors when presented with these new choices, right, that show zero deductible. So in 2024, new signups who were eligible for this, there are fewer folks choosing gold and more folks choosing silver. And it's great to get people in the right plan in the first place because switching is so hard. So if we can eliminate those choice errors from the get-go, that's great. Covered California also wanted to know, like, if people are enrolled in these lower cost sharing plans, does it make a difference? Are people going to the doctor and getting the preventive care that we want them to get? They did a really neat randomized control trial among folks who were eligible to switch into Silver 94 plans in 2021 because they were getting unemployment insurance. And they found that folks who got a nudge to do so, you know, A, they were more likely to actually switch, and B, they were actually a little bit more likely to go to the doctor in the first place. So preliminary evidence that this really is working in the way that we think it should, which is great. And then, hot off the press, wanted to give you a little preview of what's going to be discussed at the Covered California board meeting today, which is a proposal for 2025. It's still a proposal subject to the state budget, but it would continue the 2024 enhanced CSR plans that we have now for 2024, but extend that enhanced silver that's actually a gold plan with zero deductible. We need a better name. Like, this turquoise thing is great. We need something similar in California, I think, because the names are crazy. It would extend that to everyone who's eligible for subsidies. So including folks who are earning more than 250% FPL. Because as much as the ACA has done for coverage and access, which is a lot, I totally want to second what Colin and Natasha said, that, you know, this is all built on the basis of the ACA and the improved premiums, the improved premium subsidies make this all possible. As great as all of that is, silver plans don't compare favorably to the average job-based coverage plan, right? For most folks in California with job-based coverage, they're getting gold or platinum level plans, and the copay is $25 to $30 to go to the doctor, and the deductible is less than $2,000. So it's really exciting that Covered California's kind of benchmark might be getting closer to what the average is for job-based coverage. And I'm really excited to see what Covered California will continue to do to build on the ACA. And I will certainly be tuning into the board meeting later today. Thanks so much.
Great. Thank you, Miranda. Really appreciate, kind of the latest and greatest updates. I too will be tuning into the board meeting. Next up, we are going to hear from Laura Waddell, who is with New Jersey Citizen Action. Laura?
Thank you so much, Natasha. Thanks, Miranda. I mean, this has really been educational for me. So I'm very excited to be here. I wanted to first, in case folks aren't that familiar with New Jersey Citizen Action, I just want to kind of give a little bit more information about us. So we are a statewide advocacy and empowerment organization. We advance social, racial, and economic justice for all, while also meeting the pressing needs of low and moderate income New Jerseyans through education and direct services. And we fight for a New Jersey where everyone has a voice and equal opportunities to thrive. And on the screen there, just some of the program areas and issue work and our direct services. So next, I wanted to also talk to you a little bit about how we come to this work of affordability. So New Jersey Citizen Action convenes the New Jersey for Healthcare Coalition. We've done this since about 2008. It's our state consumer health coalition. We are, I should say, a leading voice in federal and state healthcare. You know, more than 70 member organizations are represented there for over 2 million of our state's residents. And we're dedicated to working to ensure quality, affordable healthcare is available for all New Jersey families. And I put up here just some of our health policies that fall under the mission of expanding access, increasing affordability, and improving the quality of healthcare. You know, we're on that long road to universal coverage. We've have been able to see a covering of all of our kids, regardless of immigration status. And now we're working on how to create, or I should say, creating an opportunity for adults to be able to buy in to an affordable health coverage option, adults who are currently barred from coverage. And then we also are working on addressing medical debt. And the reason why I wanted to make sure that I put this here is because we see that our premium alignment effort is really prevention of medical debt through affordability. So we are working not only on preventing or making healthcare more affordable, but also under the umbrella of addressing medical debt as well. So in some of the other ways in which we're doing that is through exemption law reform, medical debt, banning medical debt from being reported, and created a court diversion program. Next slide. A little bit about healthcare coverage and affordability in New Jersey, so you can kind of see why we need the premium alignment. You know, prior to the unwinding, the federal unwinding, we had about a 6.8% uninsurance rate, about 630,000 people. And when a New Jersey study was performed, 44% of uninsured New Jerseyans, they reported that the reason why they did not have insurance coverage was because it is too expensive. So that's a shocking number, right? And it's also been reported that New Jersey is estimated to see this year an increase in insurance premiums from 3.8% to 8.3%. So all of these things, are, just mounting the reasons why New Jersey needs to continue to work on affordability. I mean, it's causing exponential downstream effects of people, not being able to get the care that they need, and on top of that, struggling with medical debt when they do get the care. So it's all connected, really. And so working and continuing to work towards making healthcare more affordable is such an important issue for us. And especially, we're not finished with the unwinding. And so, there are still, like everywhere else, many people are losing coverage because of Medicaid redeterminations in New Jersey, as they are in other parts of the country. So many reasons why to focus on affordability. Next, thank you. So a little bit about the market, insurance market conditions in New Jersey. So for gold plans, there are only 1.4% of people who are enrolled in gold plans in New Jersey. I mean, this is the lowest in the country. We have, as we saw in the previous presentations, gold plans are really the closest equivalent to employer coverage. And so, but unfortunately in New Jersey, there aren't as many people enrolled, and it is way more expensive. In fact, the least expensive gold plan in New Jersey is on average 37% more expensive than the least expensive silver plan. And that's compared to 4% nationally. There are 81% of people in New Jersey enrolled in silver plans. So it's certainly imbalanced here. And I just, showed just a little snapshot here of New Jersey compared to other states of premiums even before subsidies have been applied. In New Jersey, the lowest cost silver premium plan, or I should say the average lowest cost silver premium plan is like $459. And for gold, it's about $630. So a big disparity there. Thank you. And just to kind of finish up with the market, we see that against just looking at Pennsylvania, for example, Pennsylvania and Texas, for New Jersey, with the percentage of people making selection in gold plans versus New Jersey, who are over 200% of the federal poverty limit, 56% in Pennsylvania, Texas, 55%, New Jersey, it's 2%. And then in looking at the lowest cost gold plans in comparing mid-sized cities, Newark, for example, in New Jersey, for the premiums of the lowest cost gold is $229 versus Pittsburgh, PA, Corpus Christi, Texas is $52.48. So big reasons that we need to make these plans more affordable for people to be able to use and enroll. And so that brings us to S1971, our premium alignment effort here in New Jersey. It is a bill that, as we heard of all of the reasons why, states should want to do it and why New Jersey, we are working towards it in New Jersey. But, again, it just provides better value. Our healthcare patients and families and individuals, consumers, on the ACA marketplace will be able to just get a better bang for their buck, really better value for the insurance that they're purchasing. They'll be able to have lower cost sharing burdens, and it also discourages gaming of the system as well within the industry. It will make the gold plans, as was mentioned, less expensive than silver. And we already mentioned how great it would be for more people to be able to benefit from a plan that is very much like employer plans. And so the bill itself in the first year would make gold level plans, plan premiums would be equal in cost to the silver plan premiums. And then in the second year, gold level plan premiums would be lower cost and less expensive than silver level plan premiums. So, should our bill pass, and we are working hard every day to make sure that it does, in a 2-year phasing, the gold level plans will be less expensive and more easily accessible for New Jerseyans to purchase. Just a little status of the progress of the bill. Before the ending of the last legislative session, which was about in December of last year, it passed out of our Assembly Financial Insurance and Institutions Committee. So that was a win there. So that was good. In the new session, it has been reintroduced. Our new legislative session started January of this year, or I should say mid-January of this year. So the bill has been reintroduced. And so we're still waiting for a committee hearing. So we did get some progress in last session with the new legislative session. Unfortunately, you have to kind of start all over again. So it needs to still move through both houses, the Assembly and the Senate. But the fact that it had some success in last session only helps the effort. And I would say some of the initial opposition that we saw in that Assembly hearing from last year was from the health plans. And it has been our experience where we think really that was more about just education. And so since that hearing, we have met with and will continue to meet with the health plans and really just kind of inform or review, what this actually is, because it's kind of wonky, right? So, I think we've made some good progress on being able to demonstrate what the bill does, what premium alignment really is. And what's been really helpful is to be able to show the successes of premium alignment efforts in several other states. And so I think that with continued discussions, I look forward to making even more progress there. And I would say our next slide. Yep. I just wanted to give some general elements, or I should say some key elements, which all of our panelists have spoken about, but I just wanted to quickly go through this in the next few slides, because I know we want to have enough time for questions. But the biggest thing here is, premium alignment really gives some clear rules of the road and make sure that there isn't a gaming of the system, so that all of the insurers, kind of have to play by the same rules, and in order for it to really work well. And the next slide really shows that what we've heard from our panelists about how it's been going in other states. I just wanted to kind of briefly show that some of the early adopters have been Maryland and Wyoming, another wave of it in Pennsylvania, and of course we heard of Colorado, and then in New Mexico and Texas a little bit more recently. And so, it's definitely policy and an effort that has certainly caught on throughout the country. And this is just some interesting tidbits. There was tremendous gains for consumers in the first year when New Mexico and Texas passed, and their carriers really can benefit from it. And there really hasn't been any doom. Carriers are still able to prosper, and consumers and patients are still able to afford their insurance. And then the last slide here is just kind of like a compare between the New Jersey bill and two of the other states. And so I will finish there, and thank you so much.
Thank you, Laura. Really appreciate you giving us an update on the status of New Jersey's latest affordability efforts, and also helping to let us know that this is a part of a much broader affordability effort. And so now I want to reserve the remainder of our time for questions and answers. You've now heard from our experts and our panelists, and I want to have the opportunity to, kind of pose some specific questions to them. So appreciate our attendees who have dropped questions in the chat. So the first question that I would like to pose to our experts today as they join me on the stage is, how are states affording or funding some of these affordability reforms? Are you able to successfully offset the rise in enrollment costs? And are you seeing enough overall savings in healthcare costs to offset that increase in enrollment? So Colin, I think given the fact that, New Mexico is somewhat farther along in their journey, I will pose that one to you.
Sure. That's a great question. So as I had noted in my presentation, when the health insurance provider fee was repealed at the federal level, our state stepped in, collected that revenue at the state level. And so that is the underlying funding source for our programs. And so far, even with the enrollment increases, we've been able to continue to offer these programs and actually build upon them. It's been a really good revenue source. It's very stable. And it's actually been so successful that our legislature has distributed more money towards these programs than it had been in the past. So far we haven't run into any issues there, but of course we always have to monitor our budget and make sure that we've got the resources we need to continue the programs.
Excellent. Thank you, Colin. And then we've gotten some additional questions, recognizing that, changes like this don't happen, in a vacuum. And there are a lot of forces that are at play, as advocates and policymakers and research try to actually advance some of these affordability reforms. So I will pose this to anyone who feels comfortable answering. How have you been able to successfully address some of the opposing viewpoints and concerns from other stakeholders like health insurance carriers? What has been the tools that you have utilized to either educate them, as Laura mentioned in her presentation, or overcome some of the concerns that they have to possibly stall some of these affordability mechanisms?
I mean, I'll just add to what I said before. I mean, we just sat down, on the virtual table, and we're available for the kicking of the tires, as you would say, and just really went through the bill, what it did, what it didn't do, and because it is the right thing to do, and it is a successful model. I think that our arguments were sound. I think that we were successful in those meetings, and have generated interest in future meetings.
Fantastic. Glad to hear that kind of that proactive outreach and education to some of the entities that, may stand in the way. My next question I would like to pose to Miranda. So as a researcher, what are, the data collection and analysis that states who might be at the beginning of their affordability journey, what are some of those things that they should consider as they start to pursue some of these initiatives or reforms?
I mean, I think it's understanding the problems is the first step in figuring out what makes sense to address. So looking at where people are enrolled and by income, right? Because having a deductible is going to mean something very different if you're at 400% than at 200%, and really thinking about what it is that people can afford and where the pain points are. Yeah.
Excellent. Thanks so much, Miranda. And we have actually a more targeted question, so I'm going to send it back over to you, Colin. This question does the New Mexico Exchange have active purchasing authority to be able to display turquoise plans ahead of other plans?
So we are not an active purchaser state. It really had to do with just the design of our marketplace. Some of this really had to do with how these out-of-pocket cost reductions were aligning with our premium assistance programs too. So we are actually able to make these plans that have very low out-of-pocket costs also have very affordable premiums. And so it was really a matter of us just saying, we want to make sure that these plans that are going to offer the best economic protection for people are displayed right up front. And it was really an internal design decision about that. All of the other carriers' other plans are, of course, displayed in that, and there are different ways to sort choices, but we thought that this would be the best sort of default for people to be able to make that choice around their health insurance.
Excellent. Thank you. Another audience question is, what are the panelists' thoughts on how states could leverage thoughtful design to magnify the impact of affordability initiatives? So I will let anyone, Miranda, I see you're off mute, so I'll let you take that one.
Just to sort of build on what Colin was saying, I know that Covered California has thought a lot about the design architecture and what people see first. And my understanding is that the first thing that folks see is the lowest total cost plan for their particular situation, right? You don't want to advertise the bronze plan first. You want to show, if you're eligible for that silver 94, you want to make that front and center. And I think one of the really interesting things about getting rid of deductibles is how that plays in just sort of sticker shock, right? Getting rid of that, oh my God, $5,000 deductible. Like, oh, zero deductible for my $90 a month. Like, great, I'm getting something here. Even though there's all that thoughtful design in the plan design, the deductible only applies to hospital, blah, blah, blah. Like that sticker shock, I think is real. And I think, we'll have to see as the data comes in, but I think is going to really make a difference.
Fantastic. Thanks, Miranda. So an additional question that we received, and recognizing that, state policy action and innovation happens, kind of in a larger ecosystem. And I know that we do have some of our federal partners on the line. And so for any of our panelists, what are ways that our federal partners can best support states as they pursue affordability reforms?
I don't know if the other panelists have anything to say on this. I'll just say that working with CSIO has been incredible. They have been very supportive of what we've needed to do to make these programs work, and some of the more challenging, just technical aspect of it, and they've been real problem solvers. So I think just supporting states in figuring out how to do this in a way that, of course, is within the guardrails of the ACA and in compliance with the law, but really allows states that flexibility. I do think that there's opportunities in the future, and this might need congressional action, but to really revisit 1332s and how deficit neutrality is addressed, because a lot of states don't necessarily have the initial funds to set something like this up, like we've been able to do in New Mexico. And so for those states, figuring out a way to provide additional federal resources where states are able to save on per member costs, really to make sure that they can reinvest those into programs that are that address out-of-pocket costs.
Great. Thanks, Colin. And I know we are rapidly approaching the end of the hour, so I would actually like to kind of leave us with a final question that I would love to hear from all three of our experts on. And that is, what is the future of, the fantastic reforms that you all have lifted up, in a world in which these enhanced premium tax credits may not be continued post 2025. So we'd love to hear your thoughts, underscoring maybe the importance of, kind of that federal infrastructure and supporting these state affordability efforts.
I guess I'll just go. But, this is exactly why programs like this are so important. The focus of this webinar, this event, going beyond, affordability beyond premiums is so, sometimes it has been lost. And there has been such a focus on, trying to get premiums as low and providing more assistance and subsidies to premiums like the advanced premium tax credits, which, it is part of making healthcare more affordable, which is very important. But the focus on the cost sharing, because, having an affordable plan and not being able to use it because you can't afford to go to the doctor and pay, your portion of the services is almost like not having the insurance, right? And so more and greater efforts we're hoping to see in the future that will focus on the cost sharing, and we'll keep working at it at Citizen Action and in New Jersey, and hopefully we'll be able to see some new and innovative efforts coming down the pike from the federal and state initiatives and work on that.
I would just echo how important the federal supports are and the enhanced subsidies. That really, California has been focused on affordability and will do what it can, but it can't replace those federal subsidies. And they've made such a difference in improving affordability for folks on the premium side of things. And, with all of the Medicaid unwinding that's happening, for folks to be able to have a plan that's free if they're just incoming out of Medicaid is huge. It's huge. So there's a lot of work that states can do to help improve the out-of-pocket stuff, but really that goes hand in hand with the federal premium supports.
Yeah, I would echo that 100%. I mean, I think that in order for people to sign up for the plans that really have lower out-of-pocket costs, the barrier to entry still can be premium. So if you don't have those aligned, then you're not going to be able to really maximize the number of people who are benefiting. So those Inflation Reduction Act subsidies are key. Certainly, we're planning for both situations, right? If those get extended, we can do some additional incredible things, including looking at folding in dental and vision benefits into some of these programs, or improving affordability further up the income scale when it comes to out-of-pocket costs. But if those subsidies go away, we have to make some really difficult choices about how we allocate our resources, and ultimately it's going to mean that the healthcare is less affordable for consumers and patients, and I would hope that nobody would want that. So.
Great. Thank you so much, Colin. And as we conclude today's session, many, many thanks to all of our presenters, Colin, Miranda, and Laura, for sharing your expertise and insights. I appreciate everyone joining our first kickoff session in our speaker series today. I want you all to save the date for May 16th, where we will be reconvening again at this time for a session focused on enhancing consumer protections and improving the value of insurance. Again, thank you, and I hope everyone has a great rest of their day. Check out the recap. It'll be available next week.